In today's 2-minute top tip on the 30-day challenge, I'm going to take you through why trying a period of physiotherapy or physical therapy or finding somebody that's qualified to help you with some rehabilitation for your osteoarthritis is a good idea, starting right now. Now, I know this may come across as a biased video, so before we get into it, I'm going to freely and happily admit that physiotherapy or physical therapy does not work for everybody. It works for some people and it doesn't work for others. However, what I would say is that there are very few downsides to trying physiotherapy or physical therapy, and it's likely to improve your symptoms, or at least the knowledge of your symptoms, in some way. Probably one of the best things about physio or physical therapy is that it's non-invasive, which means that all of the things that we can do to help you are not going to involve injecting something into your system or doing any surgery to you. Surgery that in some instances you may not actually need. Now, it is fair to say, and is definitely the case in the UK, that physiotherapists have more time to spend with patients than doctors, GPs or consultants. This means that we have more time to sit down with you and talk to you about your osteoarthritis, help you understand what it is, how it works, and the normal things that we would expect if you have an osteoarthritic joint. We have time to talk to you about pain, which is really complex. We can tell you about how it works, the different sorts of factors that would affect it, things like sleep, nutrition, diet, fatigue, work, your perception of osteoarthritis. All of these factors matter, and all of these are things that we can talk to you and educate you about. We can help you put management strategies in place to help you manage your pain better at home. It's also highly likely that we will take you through a course of rehabilitation that hopefully would be done over an adequate period of time, progressed over that period of time, and again, giving you the knowledge to continue that program after you finished your course of treatment. Now, for a lot of people, trying all of those things does actually dramatically improve their symptoms. It makes them have less pain and it makes them feel like they can manage their symptoms better. If, however, you've done those things for an adequate period of time and you don't feel like you've reached a level of function that you're happy with, then that is unfortunate, but it's also fine, and you're still in the right place, because your therapist should then be able to talk to you about what the invasive options are, the pros and cons of them, and again, have that time to discuss those options with you. And if they are appropriate at that stage, then at least you have the knowledge about your condition, about how to manage it, and your joint is probably in a healthier position than it was when you first started. So the message is that physiotherapy or physical therapy doesn't work for everybody, but my view is that there are very few downsides to giving it a try. Worst case scenario is you do go on to have some invasive interventions. However, you're more empowered and you have more knowledge about your condition, which means you're more likely to manage it better at home. If, like me, you enjoy spreading arthritis positivity and you'd like to get your hands on one of these Arthritis Inspiration t-shirts, then I've popped a link to the shop in the description below the video. Question of the day: have you tried physiotherapy or physical therapy, and how did you get on? Let me know in the comments section below the video. If you have found today's video helpful, then please do consider giving me a thumbs up. It helps the channel. And if you're new around here, subscribe so you get notified every time I release more osteoarthritis help on the YouTube channel. And once you're doing that, I'll see you in the next one.